when you're talking with healthcare executives, are they having any, troubles prioritizing, or do they feel pretty clear about here's what we tackle first, second, third? Because there's only so much room, only so much resources, margins are slim, you really have to kind of choose.
Yes. I mean, I think, so yes, margins are slim. I think it's really critical to sort of emphasize that, right? And that's a really great point, Kerry. These are razor thin margins, right? And so there's a lot to prioritize, right? So there's a lot of plates spinning or whatever cliche you want to use. They all tend to go, I'll stick with this sort of circus, a lot of balls in the air or a lot of plates spinning. I think most people are trying to prioritize this sort of brick and mortar care options versus at home care options. Seems to be a huge priority for health for providers. I think finding the right use cases for AI is also right up there, and then I think kind of next to that, managing any kind of workforce or staffing shortages in the workforce. I think that those are the three. There's certainly others. I'm not suggesting that there aren't others, but those are the three that I see kind of continually kind of making their way to the top.
So let's maybe kind of break those down. The first one, sort of moving outside of maybe the brick and mortar, kind of shifting sites of care, shifting models of care. Tell me a little bit about how maybe patients are kind of helping to drive that narrative.
I think that it's a far more patient-centric or consumer-centric industry than maybe it's been in maybe ever, right? So the more often than not, I'm going to use the word consumer in this case. The consumer has had choices that they have not previously had. And so there will always be a need, for better or worse, to go into a hospital setting and receive some sort of treatment of some kind, right? I mean, typically, if you're going to go deliver a baby, you're going to want to do that. Most people anyway, in a hospital setting, and there are a number of acute medical conditions that you really need to go to a hospital to have addressed, right? However, there are lots of things that again, in this case, I'm going to use the word consumer, that the consumer faces where they have a choice. He are able to say, hey, do you know what? I actually want to try to deal with this at home, or I want to try to deal with this just down the street from where I live versus going to a hospital. And I think the provider, whether they're the large health system or more local or community providers, need to bring solutions to the table for that consumer. How are you going to sort of deal with this at home, or how are you going to deal with this a little more locally? And they have prioritized that, but it's the consumer that has the choice now to say, hey, do you know what? I prefer to deal with this virtually, or hey, is there a way that I can deal with this, on my phones, or whatever the case may be.